Podocyte Talk Episode 6, Metformin in Advanced CKD, Cardiovascular Risks of Immunosuppressive Therapy, and Blood Pressure Control in Low Diastolic BP. Welcome to the 6th episode of Podocyte Talk. Today we're covering 3 intriguing studies that shed new light on managing kidney and cardiovascular health. The first study, conducted in Scotland, examined whether continuing metformin in patients with type 2 diabetes and advanced CKD is safe and beneficial. Metformin has long been a cornerstone of diabetes management, but guidelines recommend discontinuing it when kidney function drops below an eGFR of 30 milliliters per min, spor 1.73 milliliter, due to concerns about lactic acidosis. However, evidence supporting this recommendation has been limited. The study followed over 4,000 patients who were using metformin when they developed stage 4 CKD. Some continued the medication, while others stopped it within 6 months of their CKD progression. Over 3 years, patients who stayed on metformin had a better survival rate compared to those who stopped. Interestingly, there were no significant differences in cardiovascular events like heart attacks or strokes between the two groups. This suggests that metformin may offer survival benefits without adding cardiovascular risks in advanced CKD, challenging the long-standing guideline to stop metformin below a certain eGFR. While this study cannot establish causation, it highlights the need for further research and reconsideration of current recommendations. Moving from diabetes management to treatments for glomerular diseases, the next study explored the cardiovascular risks associated with immunosuppressive therapies. These medications are critical for controlling disease progression, but may carry long-term risks that require careful consideration. This retrospective study followed nearly 2,000 patients with conditions such as IgA nephropathy, FSGS, membranous nephropathy, and minimal change disease for several years. It found that while corticosteroids did not independently increase cardiovascular risks, calcineurin inhibitors like tacrolimus and cyclosporin significantly increased the risk of cardiovascular events, especially with higher cumulative exposure. Cyclophosphamide was also associated with higher cardiovascular risks, while antimetabolites like mycophenolate and azathioprine had more nuanced effects influenced by kidney function and proteinuria. These findings emphasize the importance of tailoring treatments in glomerular diseases, balancing the need to control disease progression with the potential cardiovascular risks of these therapies. Finally, shifting focus to blood pressure management, the third study analyzed the effects of blood pressure lowering interventions on cardiovascular outcomes and all-cause mortality in people with different baseline diastolic blood pressures. The meta-analysis combined data from 5 major trials and included over 16,000 participants. It found that more intensive blood pressure lowering reduced the risks of cardiovascular events and all-cause mortality, regardless of baseline diastolic blood pressure. Even in those with lower diastolic blood pressures, intensive treatment was not associated with harm. This challenges concerns about aggressive blood pressure lowering in individuals with low baseline diastolic pressure and supports the intensive blood pressure control across a broad range of patients. Together, these studies underscore the complexities of managing kidney disease and associated treatments. From reconsidering the use of metformin in advanced CKD to balancing cardiovascular risks with immunosuppressive therapy and optimizing blood pressure control, these findings offer valuable insights for improving patient care. Thank you for joining us for episode 6 of Podocyte Talk. Be sure to check the episode description for links to the studies discussed today. We'll be back next week with more updates on nephrology research. Until then, stay informed and take care.